Hi, this is Dr. Kiran Tipirneni, and in this video I'm going to talk about snoring. What is snoring? Snoring is actually a condition where people make noise at night while they're sleeping. This is usually seen in people as they age, more often in men than in women, but it can happen in either gender. The primary sources of snoring include the areas of the upper airway. This includes the soft palate and the uvula region. It can also include the back of the tongue, called the base of tongue, or even the epiglottis, or the lid to the voice box. What happens when individuals sleep, sometimes the airways relax when you're breathing in. When that happens, areas can collapse and fall backwards, such as the palate falling backwards and vibrating, the tongue falling backwards, or the epiglottis falling backwards and causing a vibratory noise, and that in essence is snoring. Snoring by itself is not a medical condition, meaning it doesn't lead to other health-related problems, but it can be a social nuisance. And we see quite a few patients here that are brought in by their bed partners saying that they're unable to sleep because of the loud snoring. When someone does come in for snoring, we need to assess them to make sure it's just snoring by itself and not associated with obstructive sleep apnea. Why is that? Because obstructive sleep apnea is a medical condition. Not only are people snoring, there's periods when they actually stop breathing or not getting enough airflow to their lungs or to their body at night, and that can lead to other medical conditions down the road. So when we first assess a patient, we do a complete thorough history and physical examination, as well as usually recommend they get a sleep study to determine if they just have snoring or if they have mild, moderate, or severe sleep apnea.